So I am now in chapter 11, or excuse me, 10, Physical Therapy and Cardiovascular Pulmonary Conditions. This is a good chapter. I think the author, in this case Tiffany Hilton, put together a really good chapter about two of our very important parts of our vital existence, which is our heart and our lungs. So you want to start with the objectives once again to help you, and go for these key words. And I cannot talk about them enough, but know that this is the number one killer of human beings is cardiovascular disease, and you can see those statistics. And many of these conditions are preventable. Some of these conditions are acquired, are certainly acquired at birth. Some can be genetic, but for the most part, having these health conditions, many of them, is preventable. And we're certainly seeing an increase in asthma, for example, being related to the degradation of our environment, among other things. So you really need to know the anatomy of the heart. You've learned this in anatomy and physiology, but I want you to be fluent in the anatomy of the heart, because it's important to be able to describe to the patient, when they're talking about, what's happening in the heart system as a muscle, that you're able to speak with some authority of at least knowing how blood passes through the heart chambers, for example, and how it enters the heart and how it exits the heart. I think the pictures are quite good. So that's kind of what I basically want you to know, is the anatomy of the heart, and just this section right through here of these, knowing about the two chambers, the right receives blood through the body, the cava, and then how the oxygenated blood passes through the bicuspid valves. And that's kind of where I want you to stop in terms of, I think that information is just really good, and hopefully it's recent that you've taken anatomy and physiology, but if it's been a little while, I would read up on it again. Know the definition of respiration and ventilation, inspiration and expiration. That's important. And how air is received into the lungs, and how air is moved out of the lungs. You need to know those upper airway system, as well as knowing the lower conducting airway system of the trachea and the bronchial system, and those tubes that are part of the bronchial system. As far as common diseases, certainly know the importance. It talks about how important it is for the PTs and PTAs to know about these two systems. You want to know the definition of ischemia, related to the inadequate blood flow, and the coronary heart disease, and what angina is. It's important to know those basic definitions, because you'll see them on charts and in regards to health conditions. Know the basic definition of cardiomuscle dysfunction, heart failure. Know what congestive heart failure is, and then the difference between obstructive and restricted lung diseases. And we'll talk about that more in 103, but the basic definition of both is important. And that cluster diagnosis of COPD, and what COPD looks like in terms of symptoms, and the basic definition of dyspnea. I think some of you have seen that term already in 101. In 101 lab, we've talked about it a little bit. And then so you have obstructive pulmonary diseases and restrictive lung diseases. As far as the principles of evaluation, I think that's important to see and to know about, but not to memorize at this stage, or to hold to memory. I would rather you learn kind of the invasive. You have just one. specifically here called out, which is cardiac catheterization, which is a way of using a catheter to monitor the working of the heart. And it's important to know what that is, because you'll have people that are on cardiac catheters serving a very important function in terms of certainly you have a catheter, but it certainly can be used to assess how much pressure is being generated by the chambers of the heart and the strength of the contraction within the heart muscle as well. Non-invasive procedures, there is an echocardiogram and an electrocardiogram. There's just a little bit of difference in the two. Both, again, non-invasive. And what an electrocardiogram looks like. I'm not going to test you specifically on the T wave and ST segment, but I know you've learned these already. The exercise stress testing is important. You do see PTs and PTAs involved in exercise stress testing. You're seeing this even more now in skilled nursing facilities. Not maybe as thorough as what's described in this chapter, but these components of exercise stress testing are being used much more systematically and strategically within skilled nursing facilities where older adults come in with risk factors associated with cardiovascular diseases. I'm not asking you to memorize the Bruce Treadmill protocol, but it is an excellent protocol and something you'll see more in 103. And some of the basic imaging for lung tests and procedures. I'm not asking you to memorize every component of pulmonary function tests. You certainly can, I think, important to know what a bronchoscope is, as it's used to remove secretions from the lung. A blood gas analysis. I don't want you to split hairs necessarily about that, but it is something that is used to test for the presence of oxygen and carbon dioxide in the system. You don't have to split hairs on the principles of evaluation and diagnosis and prognosis. You know that is the role of the PT in terms of establishing a plan of care. I do think it's good to know about these basic definitions post-surgery or that involve surgery, the CABG and the pacemaker, to know a basic definition on both of those, and to know some of this basic information about what determines and what influences a successful recovery. I don't want you to memorize all of these, but it just, I think, is a good information to start to get familiar with. And again, I'm not asking you to commit this box 10-2 to memory. I think it's asking a bit much without having supplemental information. You don't need to memorize all the PT cardiac rehab procedures. You'll learn more of those, especially as you get into PTA 205 next year for the complex medical systems or complex of health conditions. I do think the FIT principle is a term to get familiar with, but I don't want you to memorize all of it in terms of the recommendations for inpatient. You're going to learn more about target heart rate. This formula is one you really want to get committed to memory, and will you apply it more in 103? It's important to be able to establish a target heart rate. But don't split hairs about all of it, but just get familiar with it. It's important to be able to establish what the exercise tolerance is, and you'll occasionally get patients that will ask what their target heart rate is, and that's certainly within your scope to determine that if they're safe to exercise to their and establish a target heart rate, depending upon their health condition and their stage in rehab. We're not using a lot of postural drainage, especially here in the West Coast, but I think these pictures are good to at least be familiar with. And then finally, you do want to learn the box 10-3 benefits of strength training and aerobic conditioning.